Hi, it's Andrea, Stoma Warrior. I just want to catch up. So this week I spent up to an hour with a Crohn's specialist dietitian for my appointment with my consultant, who has decided to take me off my Upadacitinib, which is the JAK inhibitor I was on for the bowel disease, because it's not working and, excuse me, hiccups, and it's causing havoc with my liver and my kidney. So coming off those anyway. So I had a good chat with the dietitian, amazing lady, very qualified, very knowledgeable in Crohn's, which is refreshing. So it's not just general information. And we're looking at a liquid diet of Eshore. They do different ranges of thick shakes, compact shakes, juices. Have tried Modulum before, but made me gag. It's really creamy and disgusting. And we're possibly looking at doing 2 weeks solid liquid diet and then a combination for 4 weeks, just enough to give me a break until we find some new treatment. It's not something I want to do for life, but who knows, if I lose weight and feel great, then maybe. She was fascinating, actually. She was really good. She sort of pulled out so much information that I wasn't even thinking about. Things like I'm on bowel acid malabsorption medication, which basically is a bile salt sequestrant, which binds bile acids in the bowel. She pointed out only does it in the large bowel or in the J pouch, which was what I had at the time, which was an internal pouch made out of my small bowel. And she also pointed out that the fact that I have it now and I have a stoma is completely irrelevant. I don't need to be on it because it's basically trying to bind bile acids in my bag, and that's not going to benefit anybody at all. In fact, it's quite nasty because they're not the nicest things to take. They do have side effects. I couldn't say what they are because I've been on them so long I can't remember. And they're a waste of time. They're huge. Take 4 a day. So stop them immediately. Absolutely chuffed bits with that. And we'll see. I've noticed possibly a little bit more acidic, so maybe some was being reabsorbed, but nothing bad. She's added in omeprazole as a way to sort of halt the damage or anything being done in my stomach. And she spoke about up in the loperamide, because she said basically quarter of an hour before I eat, take loperamide. That halts the stomach from working for a short time, and that gives the food plenty of time to absorb, to get the water absorbed, so that I don't have such runny output, and it helps thicken it, but also so I start absorbing the nutrients and everything else, rather than it just flushing through me. She gave me a little bit of a lecture that I was drinking too many liquids in a day, which is possibly why I'm so watery. I've always been an advocate for less is more, quality not quantity, but I get so thirsty throughout the day for various reasons. One, that the Upa gives me oral thrush and that drives me nuts and I get a sore throat. So she said now to do 1 litre a day of St. Mark's solution, which randomly I love. I put lemon in it and it's absolutely fine. I'm so used to it. It's quite nice. And to limit the rest of the day to 1 litre, which is going to be quite hard for me. She did say if I have alcohol that comes out the litre, it's fine, but she did say not 1 litre of wine. Spoils sport, but it includes tea and everything. So just cut down my liquids that I'm flushing out to see if that helps reduce my output. But obviously managing it if I get too hot and sweating and I need to replace electrolytes to up the hydration fluids. She also spoke to me, as I say, about the omeprazole, which I take in the morning, and I can take another one at night, which should really help with any acidity in my stomach. And she spoke about the other things going on in my life at the moment. So I've just started HRT. I've also now gone full-time in my work. I've got my son obviously going through college and the other one going through random things in his life, which is really exciting, but obviously tiring. The fact that I have inflammatory arthritis and it's really bad at the moment. Various other things. And when she said it all, it was like, wow, I've just been hit by a steam train. So I'm having a medication break. I've been taken off my Upa, it's not working. I've been taken off my bile salts medication because they're a waste of space. And I'm going on omeprazole. So to me, it's kind of a fresh start. Going to have an MRI done again on my bowel to see how bad it is, to see if Upa did actually do some good after all, or if not, and then to have a look at other options such as Skyrizi. Probably said that totally wrong, but it sounds cool, which is a new immune suppressant biologic that I can have. Potentially surgery, but I'm not convinced, because every time I've had it so far, disease has just come back around the surgical site, proven by the fact now my Crohn's is more active in the bit at the end of my small bowel towards the stoma. So yeah, quite a lot going on this week, but absolutely love seeing a dietitian. She's a lovely lady, so supportive, and went through what my body needs, what it doesn't need, how I feel. Really brought home to me what I put myself through every day, working full time, managing everything else that I do. Go away on holiday, but we don't sit still. We just rush around, and we do so much stuff and cram it in. So going to take a few days in October somewhere quiet, just to unwind and shut down. Go internet quiet, do everything. It's going to be bliss, so I'll be away for that. I'm going to give this all a go. So eating really carefully for the next 2 weeks while I trial the Ensure and see which flavours I can tolerate. Waiting for my blood stools, everything else to come back, the test results. I've had some bloods back already. I've got quite bad liver damage at the moment, and I've got a kidney problem, which is a separate issue. So give my body a rest. I'm going to monitor them. I've had to stop also blood pressure medication because that made my liver even worse at the moment, but it could just be it reacted with the UPA, which isn't proven, but I might have to try it again. So I'm monitoring blood pressure. So I'm feeling a bit ugh. So yeah, just wanted to check in and say I was really encouraged by seeing a dietitian. She was amazing. I saw my consultant, Prof Hart at St Mark's, spent half an hour with her discussing everything, then got given as much time as I possibly needed with the dietitian while I was there and then. I had my bloods and samples all taken there and then in clinic, and everything was done. Such a good holistic approach to everything that's well-being for me, not just that shebang were done. It was really, I felt everything was looked at, so really refreshing. First time I've had a face-to-face proper meeting with a dietitian since I've been diagnosed, so in my life really. Had one over the phone before, but yeah, really loved it. So if it's offered to you, take it. There's a lot coming my way as far as liquid diets, etc. Being a big foodie, it's going to be fun, but stick with me and we'll see how it goes. Take care. Bye.